Greetings, everyone. Um, Dean Stokes requested that I discuss with you the Nclex test blueprint because an in-depth knowledge of this plan will allow us as faculty to strive to make our program here at Concord congruent with the test plan. This will in turn ensure we have a strong nursing program that will enhance our NCLEX pass rates. In addition, it can help us to achieve ACEN accreditation, and I'm sure this is a goal for each and every one of us. Now, the test plan for the NCLEX RN was developed by the National Council of State Boards of Nursing, Inc., or also referred to as NCSBN. This document was designed to provide detailed information about the content areas where students will be tested on. The plan itself consists of 2019 NCLEX RN test plan, information on testing requirements and sample examination questions or items. It contains item writing exercises for faculty, and lastly, it consists of a bibliography and an appendix. The National Council of State Boards of Nursing does have a rather unique way of how it develops the NCLEX test plan. The council has commissioned a committee who has the task of reviewing and approving the test plan at least every 3 years. Now, this committee reviews several resources that helps them to devise the test plan. The resources include recent practice analysis of RNs, expert opinions of NCLEX examination committee, the NCSBN content staff, and the Board of Nursing and regulatory bodies. This is done to make sure the test plan is, or that it does follow the Nurse Practice Act. Now, after deliberations, the committee presents the test plan document to the delegate assembly for approval. This is the decision-making body or arm which is housed within the NCSBN. The test plan guides students preparing for the NCLEX. It also can improve faculty item writing skills, which we know is very important. And it also helps to classify exam items. Remember, the blueprint provides a comprehensive listing of content for each client needs category, as well as subcategory outlined in the test plan. There are sample question items provided at the end of each category, which are specific to the client needs category in that particular section, and we will go over some of that here shortly. This alone should help us develop the most relevant and effective test items to enhance students' ability to pass the NCLEX exam. You should also know that the plan contains sample case scenarios, which gives educators the tools requisite for hands-on experience in writing NCLEX style test items. Now, to ensure public protection, candidates for licensure must meet a set of requirements that include passing an examination that evaluates the competencies needed to perform safely and effectively as entry-level RNs. Several steps occur to develop the test blueprint, which includes the following. The committee, they survey about 12,000 newly licensed RNs who are asked about the frequency and significance of performing nursing care activities. These activities are analyzed related to frequency of performance, impact on safety, and client care settings where activities are performed. This analysis guides and facilitates the creation of a framework for entry-level nursing practice that incorporates specific client needs. The second step is to develop the Nclex plan, which guides the selection of content slash behaviors to be assessed. The blueprint is a concise summary of the content and scope of the licensing exam that can help guide exam development and prepare students for the Nclex. The Nclex exam also evaluates students' knowledge, their skills, and abilities that are essential for entry-level nursing. Now, there is a belief section listed in the blueprint that appears to serve as a kind of theoretical framework, though not specifically implied to be a framework. However, its concepts and principles are interwoven throughout the plan. It essentially speaks to the beliefs about people and nursing, which are fundamental to the assessment as well as cognitive abilities that are tested in the Nclex and specific components of the Nclex RN test plan. For example, a brief excerpt reads, "People are finite beings with varying capacities to function in society. They are unique individuals who have defined systems of daily living reflecting their values, motives, and lifestyles. People have the right to make decisions regarding their health, care needs, and to participate in meeting those needs." Another example and/or brief excerpt reads, "The RN provides a unique, comprehensive assessment of the health status of the client. The RN applies principles of ethics, client safety, health promotion, and the nursing process to develop and implement an explicit plan of care that reflects unique cultural and spiritual client preferences, which is the applicable standard of care and legal considerations." So these are just a couple of statements listed under the belief section that I found to be so relevant or germane to the profession of nursing today. So the blueprint outlines the classification of cognitive levels, more specifically Bloom's taxonomy for the cognitive domains for the basis of writing and coding items for the Nclex exam. As we know, to be an effective nurse, he or she requires knowledge, skills, and abilities. For this reason, most assessment items are written at the minimum application level and above. These are dubbed as higher level cognition and require more complex thought processing. Something we as faculty must teach our students. As you can see, this slide shows you the original domain on the left side, as well as the current one on the right side. The original Bloom's taxonomy described three domains of learning. They were cognitive, affective, and psychomotor. The cognitive domain was subdivided into the following mental skills: knowledge, comprehension, application, analysis, synthesis, and the last one, evaluation. The new list of skills are as follows: remembering, understanding, applying, analyzing, evaluating, and creating. Notice that the last two have flipped. The new taxonomy says that you must be able to critique and/or evaluate some aspects of the skill before being able to use it to create something new. So, as you can see, it was flipped. Now, the framework of client needs was selected for the Nclex because of its universal structure in defining entry-level nursing actions, competencies which focus on clients in all care settings. It doesn't really matter what setting the client or the patient is in. The content of the Nclex RN test plan is organized into 4 major client needs categories. 2 of the 4 categories are subdivided into subcategories, which I will cover. One of the main categories is safe and effective care environment. Its subcategories is management of care and safety and infection control. The next category, major category, is health promotion and maintenance. The next one is psychosocial integrity. And the 4th and final major category is physiological integrity. And this particular category or major category contains or lists 4 subcategories. The first subcategory is basic care and comfort. The next, pharmacological and parenteral therapies. The next one is reduction of risk potential. And the last one in this category, or as a subcategory, is physiological adaptation. So this grid shows that this is a grid that shows the percentage of items for each client needs category that you'll see on the Nclex. As you can see, management of care, pharmacological and parenteral therapies, and physiological adaptation comprise the higher percentages of items covered. Therefore, we should be seeing more of these items on our assessments. Of course, seeing the percentage of items on each of our tests we develop is certainly preferable. Now, this slide shows the categorical distribution in percentages of test items in this pie chart. So just another way to view these data. So perhaps Dean Stokes can speak to this, but I interpret this to mean that our assessments that we give our students should consist of every category in this pie chart and their prospective test items and percentages to make them more congruent and consistent with the Nclex that our students will take one day. On this slide, it shows the integrated processes that are fundamental to nursing practice and how concepts are integrated throughout the client needs categories and subcategories I mentioned already. Therefore, what we should see throughout the assessments we provide to students are the following, and I will give you a brief description of each. For example, the nursing process, we all are familiar with this one, consists of assessment, analysis, planning, implementation, and evaluation. The next integrated process is caring, interaction of the nurse and client in an atmosphere of mutual respect and trust. The next integrated process is communication and documentation, and this consists of, or it means, verbal and nonverbal interaction between the nurse and the client's significant others, and the other members of the healthcare team. The next category or integrated process is teaching, learning. This means facilitation of the acquisition of knowledge, skills, and abilities, promoting a change in behavior. And the last one, or integrated process, is culture and spirituality. And this is interaction of the nurse and the client, which recognizes and considers the client reported self-identified, unique, and individual preferences to client care. Again, the applicable standard of care and legal considerations. So here, this informs us that this slide, it informs us that 17 to 23% of our assessment items should comprise of safe, effective care environment. And here we must provide nursing care that protects patients, families, and the healthcare team. Its subcategories involve, as I mentioned earlier, management of care as well as safety and infection control. As far as management of care, again, this speaks to the protection of patients, families, and the healthcare team. And as far as safety and infection control, it involves protecting the same groups from health and environmental hazards. The next category or major category is health promotion and maintenance, and comprises 7 to 13%, which entails health promotion and disease prevention while incorporating knowledge of expected stages of growth and development. As a side note, 95% of our current healthcare system is modeled after the medical model, meaning we basically wait until a client gets sick, and then we decide to treat them at that point. However, only about 5% of our current system involves health promotion, disease prevention. In other words, a more proactive approach. The medical model is a more reactive approach. The health promotion, disease prevention is a more proactive approach. Now, this said, it is vital that our students understand the value of health promotion and disease prevention for patients, families, populations, and other groups, as this is the most cost-effective approach to care. The next category, or the major category, is psychosocial integrity, and it comprises 7 to 13%. And this category entails providing care that assists with the promotion and support of the emotional, mental, and social well-being of clients. There is a section in my textbook that actually deals with the psychosocial component of the disease process. And I always inform my students to pay strict attention to this section and not just gloss over it, because it is invaluable. As far as for the care of our patients' psychosocial dimensions, if you will. Now, the next category, which also consists of two subcategories, is physiological integrity, and it comprises 11 to 17%. But remember, this category has four subcategories with varying percentages of test items that should be incorporated in our assessments. This category involves promoting physical health and wellness by providing care and comfort, reducing client risk potential, and managing health alterations. A brief description of each are as follows. As far as one of the subcategories of basic care and comfort, which comprises 6 to 12%. So this means providing comfort and assistance in the performance of activities of daily living. And the next category is pharmacological and parenteral therapies, which comprise 12 to 18%. And here we're providing care related to the administration of medications and parenteral therapies. And the last two subcategories, the first being, or the third rather, being reduction of risk potential. And this one comprises should comprise of 9 to 15% of test items. Here we're trying to reduce the likelihood that clients will develop complications or problems related to existing conditions, treatments, or procedures. And the last subcategory is physiological adaptation, which comprises 11 to 17%. And here we are managing and providing care to clients with acute, chronic, or life-threatening physical health conditions. So I believe that is it for now. I hope you will find the information that I provided to you helpful. This is a document that we as faculty must embrace, and we must give strict or pay strict attention to the various components of this document. Again, in order to um, allow our assessments that we give to our students to be more congruent with the test blueprint. And again, this will ensure that we have a more successful nursing program, and our students will pass the Nclex exam as well. And so there's just a whole lot of information that we hope to go over in the coming weeks so that we can just make sure, again, that our program is where it should be. And so we can also achieve ACEN accreditation. If you all have any questions, you know my email. Just shoot me a quick email. And again, hopefully you will find this brief presentation helpful. Thank you.